we've had a 42% increase in hospitalizations in London in the last week. There are currently 36,000 people in hospital, so we are definitely feeling it in the hospitals and also in general practice because so many people have got COVID. But I would like to reassure that emergency procedures are still occurring. But we hear the R number and we listen to that from our leaders. And if it's more than one, it's thought to be very high risk of the transmission. And we know that with these new variants that have come in, Mariam, one from Brazil, and we heard today that, you know, travel from South America has been banned. And there's also what's called the Kent virus, something that's happened in England, and a South African variant. These seem to be new, and these seem to be much more transmissible, so one person can pass it on to another person much more quickly, and we think that it's 70% more than the original variants. That doesn't mean that it's 70% more deadly. It's not causing more death, but it is much more infectious. So in Newham, where we are at the moment, we think, again, we're not absolutely sure of the figures, but maybe 1 in 10 people are infected at the moment. And we need to remember that we don't all show symptoms. So 1 in 3 of us don't feel unwell when we've got COVID, and we might be passing it on. And that's where the 10-day isolation rule comes from. I know it's awkward, I know it's cumbersome for people, but if you live with someone who has COVID, your chances of getting infected are much higher. And that's why we ask people to isolate and not be near anybody else for 10 days so that we can see if their symptoms are showing or coming out in that 10-day period. So we know that age is a big risk factor. So we know that people over 70, over 75 are more at risk. We do know that our BAME communities are more at risk from getting sick from COVID. And then nationally, you may have heard of the term the shielded patients. These are a group of patients who are clinically extremely vulnerable. And if you will know who you are because the government will have sent you a letter. It's if you're having, for example, radiotherapy at the moment, if you've got certain cancers, and you will be asked to stay in completely. And your local council will be arranging, medication drop-offs if you need it and you live completely on your own. So these people who were thought to be most vulnerable in the first round, it's exactly the same people. So the A&E are not managing to see people immediately as we would like to. And of course, that's where general practice, people like me, are really useful because we do encourage people to contact us first. But the situation at the moment, sadly, we are seeing that R number rising. And of course, we do know that although most of us did very well over Christmas and over New Year, and, the mingling plans were cancelled, that there was still more socializing over New Year. $3 million have already been vaccinated, and the plan is to do 2 million per week. I think this is an ambitious but a fantastic target that our NHS and our government is reaching. So at the moment, although the Moderna has been approved, we haven't got the distribution. So we're working in primary care with the 2 vaccines. I'm not sure exactly what is happening in the hospitals. I'm a GP, but we do know that the Pfizer vaccine, just because of the way it's made, is a much more fragile vaccine. It's not like the flu jab where you can carry it around and give it. It has to be kept at frozen temperatures and only can be out for for a small number of hours, and that is why the Pfizer vaccine has been given in groupings of practices. You might have found that your own GP practice hasn't called you. It has been a grouping of practices. The Oxford AstraZeneca behaves much more like a flu vaccine. We can put it in our practice fridges, we can take it, and of course we're saving that for our housebound patients. In the first wave, sadly, I lost a very dear friend and colleague of mine, Dr. Yusuf Patel, who was the 5th GP in the country to die. Since then, we have learned a lot of lessons. There's a lot more protective personal equipment. And interestingly, the staff in the hospitals, particularly those that work in the ITU, intensive care units, have the most protection because they have the most, the highest quality of protective equipment. So that's much better now. We've learned a lot, and we all take more precautions. So we've learned a lot from March. Certainly, I'm not just a GP. I also run my own practice, my own business. So I have a duty to my staff. I do risk assessments on them all. And, you know, we are doing in general practice. You'll find that many people have been surprised why we don't see as many people face to face. But it's everything we can do on video or the telephone we do, so that we're not transmitting that virus to you unintentionally. So we're keeping our staff and our patients as safe as possible with our equipment, our masks, our aprons, our gloves in primary care, and so much more in the hospitals. And our patients are fantastic. They're all wearing their face coverings as they come in to protect us as well. You can still call 999 for real emergencies like heart attacks or strokes. So the NHS is still very much open, and we want to make sure that we are still looking after you despite our pressures. Anybody who thinks that this is just flu, I would invite them to come and do my job with me and shadow me for just a day. We have got young people, particularly in our BAME community, where I'm seeing 55-year-old gentlemen who are dying. These are not elderly people. The vaccination, I can fully understand why people are scared. It's a new thing, and it has been brought out very quickly, and I would recommend everybody has it. I can't see anything, and you know, I look at the evidence, I can't see anything that is unsafe about this vaccine. And compared to people who are literally dying young of COVID and ventilators full and our hospitals full of people who can't breathe, I personally can't emphasize it enough. If my mum was here today, she's passed away, I would ask her to have it, and it's important for me to keep all of us safe in our communities.